Ari, it's my pleasure and privilege to see you today here, and just you're welcome. And once again, I want to appeal to your professional qualities. You know, just you're a reporter, so professional reporter, so you are very good in picking up interesting topics.
But I'm not a doctor, you're the doctor.
But you're not supposed to, but you're a specialist in topics. So what is...
I believe that one topic, people do not like to talk about it because it's like a little bit inconvenient, I'm talking about constipation and hemorrhoids. And though many people suffer from this problem, but they're very shy about talking about it, even to their closest family members, because why to talk about it, etc. But I guarantee you it's a very widespread problem.
Listen, I agree with you, though nobody wants to talk about hemorrhoids, and it's kind of embarrassing.
And even constipation.
But I would strongly encourage everybody to talk about that, because as soon as it's a small problem, it can be managed. But if it's a big problem, it's much more difficult to manage it.
And what I know, it's not just, some people think it's only about seniors, but I know that it's not just about seniors, it's a lot of young people suffering from it, and middle-aged people suffering from it, a lot of professionals, a lot of business owners, a lot of people who work in office. And I can tell you that my own mother suffered from both of these problems, and she suffered tremendously from it. And I realized, talking to her, that they're both interrelated. Constipation and hemorrhoids are interrelated very often, because she tried to take senna, she tried to drink more kefir, she tried to eat plums, and she said that she feels differently when it's fine. Then she didn't feel hemorrhoids, but when she suffered from one problem, it led her to another problem, and she suffered tremendously from it. And she suffered from it when she was like 55, so I'm not talking about only seniors. And I will not go into details, but I know for sure that it affects a lot of young and middle-aged people, especially professionals, especially people who has irregular work schedule, I would say. So it looks to me that it also related to what people eat.
I agree with you, and that's 100% right. No, I mean 100%, not 100%, but very close to 100% right. However, what I would suggest is anybody who has constipation, it has to be immediately evaluated by a physician, because it could be a very serious problem.
So do not try to cure yourself, do some people's medicine, etc. No,
that's not what we want to do.
Some herbs, etc. No, go to physician first.
The reason for that is because it could be a very serious problem, like cancer. Yeah, constipation. Cancer is
can be related because of cancer.
Because of cancer, yes. So
stomach cancer you're talking about, or any other cancer?
Usually it's colon cancer.
Colon
usually. But everything can happen. So I strongly suggest that the life-threatening disease has to be ruled out. Okay, and the reason for that is because it could be quite deadly, and of course if it's already constipation, so it could be life-threatening. So that's one thing. Another thing is that there might be the inherited anomalies in the colon or in some other parts of the digestive system, which prevents food from passing through quite fast. And this is a huge problem, because it has to be managed surgically and not not therapeutically. The third thing, it could be a serious endocrine problem like low thyroid. Low thyroid could be, so anybody who will try to manage low thyroid with diet probably is going to fail.
The more I listen to you, the more I realize it cannot be cured by person himself or herself. They have to go to a physician.
Well, you have to go to the physician because it could be quite life-threatening, quite serious. So that is a problem, and of course, if you have such a problem, you'd better fix it as soon as possible. It's not something that you wanna.
But some people, I know some people suffering from hemorrhoids for many, many years. It's not just like they're suffering for 3 months and that's
No,
all.
just for now we are talking about
Constipation. Ah, okay.
Constipation. As soon as life-threatening problems are eliminated,
Mhm.
then you can experiment what works for you to fix this by diet, by foods.
What
by,
about prune juice? I've heard all the time. Is it true?
Well, just like for some people it works, some people are. But what I'm trying to say that you have to. It's a trial and error. You
Uh-huh.
try to figure out what works for you the best. Okay, and once again, the most important thing is to try several things, see what works. Some people are not drinking enough water. Sometimes water helps.
Wow.
Some people don't eat enough fibers. So sometimes fiber helps.
But how, for example, I came to you or someone else came to you, how do you know what exactly to prescribe? Because how do you do
Do the same thing, trial and error.
Uh-huh.
Trial and error.
Because you cannot do it from blood work, like.
Sometimes blood
to
work
see-
helps. Sometimes blood work helps. If blood work is consistent with not ever drinking not enough water, then you
okay.
can go ahead and that's it.
Mhm.
All right, and sometimes blood work shows low thyroid, so
So it could be helpful, okay.
yeah. Not enough magnesium can cause that. So
Oh.
magnesium, sometimes magnesium supplements can help with constipation tremendously. Okay, but basically the arsenal, it's not that many things we have. It's like water, fibers, magnesium, and then you just make sure that foods are natural, just.
And it's just
rough.
food or it's also lifestyle, etc.?
Of course, just the who moves more than who is not sedentary lifestyle is also might be a problem. And another thing is the personal habits, because some people try to eliminate eliminate stuff from their colon, from their gut, once a day or a certain time. But sometimes
You mean using pills or just natural?
No, they go to the bathroom.
Okay.
They go to the bathroom just early in the morning, and
okay.
when they wanna do it in the afternoon, they think, oh, come on, this is embarrassing, I'd better come home, and when they come home, they don't want to do it anymore, and they wait until next morning. So that's not what should be done. As soon as somebody feels that he needs to go to the bathroom, he needs to run to the bathroom immediately.
I mean in both cases, not just constipation, I mean for urination purposes.
See, if constipation, I'm trying to say that constipation sometimes can be prevented. So, and
yeah, you don't be shy, because
don't be shy.
Because otherwise it can lead to much more serious problems.
Right. So don't be shy. Go to the bathroom and do what you have to do.
Same story on airplane. Some people, no, let's wait until it's over.
Right.
Let's wait.
No, you can't wait. Another thing is what happens if you do wait. What happens is that the stuff that has to be eliminated becomes dehydrated because water is going to be reabsorbed. It shrinks. It becomes very hard, and of course it's much harder for your body to eliminate it.
So when you need to go, you have to go.
Go.
Yeah, it looks like simple advice, but again, listening to you, it could lead to much more serious problem if you don't go.
No, you have to go right away. Another thing is that also the food content also helps. So if somebody eats insoluble fibers like cabbage, there are two types of fibers: soluble fibers and insoluble fibers.
Okay.
So, soluble fibers is like apple; it helps with cholesterol.
Okay.
Insoluble fibers helps more with the bulk.
Okay.
Okay, so whoever needs bulk, but before trying this, we want to make sure there is no mechanical obstruction. So once again, visit to the doctor is imperative. Because if somebody has mechanical obstruction and starts using insoluble fibers, it could cost him life.
But why did you say cabbage? You mean cabbage could be a problem? Cabbage you mentioned.
No, what do you mean problem?
Is it you cannot eat cabbage? It can create constipation? What do you mean?
No. I'm saying that if there is a mechanical problem, eating insoluble fibers like cabbage
Yes.
can create a problem.
I didn't
Why
know.
is that? because if there is obstruction, like it doesn't go pass through, so we give a lot of bulk instead of going, it just gets stuck there. You know, so that's not what you want to happen. All right, so once again, it's more trial and error than a certain advice.
In terms of food, I've heard different options. Like rice is bad for if someone has constipation, do not eat rice. That's what I've heard. And completely opposite, banana is good. You know, like eat bananas and prunes also, prune juice specifically.
Once again, you know,
Is it true?
once again, it depends. If for somebody prune juice works. I have never ever heard that rice worked. But prune juice is pretty good. But once again,
No, I'm saying rice is completely opposite, probably.
yeah, I never heard that rice helped with constipation. Usually,
It's a completely opposite. Yeah, that's what I meant. Yes,
completely
yes,
the opposite.
yes.
So that's my feeling, is that once again you need to try, and there is no prescription that fits everybody. It's nothing.
So you're saying you can prescribe to one patient, say, this is your menu basically, your diet, and then to another person, no, this is what's good for you.
No,
Correct? Even
that's
food?
also that. But what I try to figure out what might be the most likely
Likely.
most likely problem, then give a solution. If solution works, good. Doesn't work, we move to another one. Works, fine. Doesn't work, we will move to third one. You know, until
And there are no pills, because there are pills that helps, you know, to fight constipation. No?
well pills.
Sometimes in hospitals and nursing homes, they even like automatically prescribe pills.
No, but that's mostly fibers or some kind of stuff that works like fibers.
Ah, okay.
Except what I strongly want to caution everybody is the pills like Senna.
Senna is so popular.
I know, and that's
So
the
popular.
problem. That's the problem.
In Soviet Union it was like norm. But even here I see
Yeah, I know that.
people like
I know
Senna.
that, but the problem is that Senna is an irritant.
Yes, correct.
It irritates. So as soon as it irritates, one after day after day after
So you're
day.
saying once in a blue moon it's okay, but not all the time.
Well, I would stay away from this. You know.
At all, at all.
At all. You know, why do?
So
you
what kind of problem it creates? Stomach could be hurt? What do you
You
mean?
know, the colon get hurt.
Everything.
Yeah, the colon got hurt. It becomes irritated, becomes inflamed, becomes discolored. It's a blue discoloration, and creates eventually a lot of problem for the person. So I would strongly suggest that, you know, you'd better
Such
stay
a
away from
popular
this.
stuff, and you're saying be cautious.
Well,
Okay.
just you know, whiskey very popular stuff too, but you know,
Yeah,
you'd
whiskey
better
is
stay away from
popular.
this.
Yeah. Whiskey is
Or
popular.
cocaine. Cocaine is
No,
very popular.
cocaine, no.
You'd better stay away from
No
it.
way, no.
No, I'm just
Okay.
trying to make an analogy.
Can we now talk a little bit about hemorrhoids?
Hemorrhoids is it's a kind of difficult stuff to manage, and the reason for that is as soon as they are there, you know, it's highly unlikely. In my understanding, it's almost impossible to get them to get them resolved. Okay, so basically, people have to live with that and have to know how to manage.
How to navigate?
Manage the situation, because sometimes hemorrhoids can be so painful that people
Cannot walk. People cannot sit, cannot walk,
That's correct.
cannot even sleep, you know.
Right. And what needs to be done is, once again, as soon as somebody suspects that he has hemorrhoids, he needs to go to the
physician.
doctor, make sure that colonoscopy or at least sigmoidoscopy is done to make sure there's nothing else. And the reason for this is because sometimes hemorrhoids can be mistaken or could coincide with fissure. And fissure is a totally different animal. It has to be treated a totally different way. You know, so yeah, not totally different. There are some similarities, but it's much more aggressive than hemorrhoids.
I know that you also favoring like so-called grandmother's treatment, like this warm water, you know, like so. I would say, I would call it babushkas, because I know that the
I'm a fan of that. But once again, it can be used only after
Everything is checked.
Yeah, everything is checked. There is no cancer there.
colonoscopy and tests and everything.
Also, what first is probably is this. So basically, we will try to get some kind of stuff that is easy to do, like, you know, drink a lot of water, no spicy food. Okay, nothing like that. So just a lot of fibers to make sure that the stool is smooth. So as soon as it passes easily, it doesn't hurt hemorrhoids.
what you just mentioned spicy food, but for some population it's a very favorable,
No, I
like
know.
people from like, I don't know, Uzbekistan, Georgia, Azerbaijan, like Latin America, Caribbeans, they love spicy food like
I
crazy.
know, but the spices can irritate hemorrhoids. Can irritate so sometimes. So you'd better figure out the balance. You know.
So if everything is okay, everything is okay. But if you have hemorrhoids, stay away from spicy food.
Try to stay away because they usually feel it like they eat a lot of pepper and next day they have trouble with it. So, and people usually can figure it out. And of course, I'm not fan of surgery because surgery is quite,
Yeah.
you know, some people are very good, you know, some people no problem with the surgery, but some people suffer a lot and pain is excruciating. Just
You
excruciating.
mean afterwards? You mean?
After, yeah, because before it, you know, as soon as it heals, the healing process can take a lot of time, and basically the reason for that is what I try to talk about old way to fix it is the baths, yeah,
Warm water.
warm water, but it's not that easy, because if it were that easy, everybody would be cured from
Yeah,
hemorrhoids.
but
and,
people should do it also, should take time to do it.
there are
etc.
some tricks. There are some tricks. So basically, what we do, we try to teach people how to do it, and it works. Because if somebody starts doing cyst baths without, you know, proper instructions, they are going to fail. They are going to fail. I trust me.
Okay, one man had a problem and he shared with me that he helped him to fix the problem. That's how I know.
Oh,
That's how I know that you recommend it.
yeah. But I recommend it in a very specific way, and that's why I think it works. So basically, the person has to come and be evaluated. It also we usually recommend, unless there are some I forgot.
And it helped him tremendously, by the way.
Yeah.
Tremendously.
Usually it works very well. The problem with I just want to make sure that magnesium, not everybody can take magnesium. And before taking magnesium, every person has to consult his physician, because some diseases, if a patient has some diseases, he cannot take magnesium. It can cause his heart to stop. Okay, so just with magnesium, everybody has to be very, very careful. Okay.
In any case, everything that should be prescribed by the doctor, not like
No.
you like watch it
No,
now
no,
and then
can't
you
do
say,
that.
oh, I will do it myself.
No.
Again, first you go to physician.
Right.
First you go to physician.
Lights, electrolytes have to be checked. If somebody doesn't check lights, there is a problem there. And also, what needs to be done is this. Sometimes supplements helps, and we usually recommend copper, and we recommend zinc. Zinc helps with healing, and copper helps with veins to heal veins. So, but the problem with this is that those two things have to be used very carefully, and only after physician supervision.
Do you agree with me that again, constipation and hemorrhoids are interconnected?
Yeah, it is connected. It is
Okay,
interconnected, that's
okay.
for sure. But just I want to caution everybody: when somebody takes zinc or copper, you'd better take it under physician's
Supervision.
And the reason for that is this: copper and zinc share the same transport mechanism. So as soon as somebody takes a little bit more than it's supposed to be one of them, the matter is blocked. So if somebody takes uncontrollably takes supplements, it can create so much problems with zinc and copper.
It will not fix the problem, it will create more problems.
Yeah, it will create much more problem, because people think that they can take zinc, they can take copper without control. No, it's a very dangerous stuff, because as soon as one goes up, another goes down and can create huge problems. Can't even imagine.
Also, you mentioned already like food and everything, but what about lifestyle? I know in general you're against smoking and drinking,
Yeah,
but will it affect hemorrhoids? Will it affect constipation?
Well, alcohol, as my understanding, yes. Smoking, I am not sure about that. But being physically active definitely helps, because it makes the stuff move fast through the digestive system.
Is it true that people having both of these problems often sit a lot in the office, just sitting, not physically active?
Of
Is it
course,
true?
that's what we're talking about. People
Yes.
has to be physically active.
Mhm.
It's not only for constipation; it's for everything.
everything,
You know,
yeah,
if they
that's-
don't move. You know, first of all, somebody doesn't move. What question I ask myself is why this guy is not moving? Is he
It
tired?
could be work, in the office, at computer whole day,
Okay.
phones, like
This
etc.
is 8
etc.
hours a day. Then what?
Yes.
Then what?
Then sitting on a subway or in the car, then sitting watching TV, eating.
Okay.
So no
he's sitting and
physical
watching TV,
exercise.
but who makes him sit and watch TV? He can go around. And
Himself.
that's the problem. So I'm asking myself
Or
always,
herself.
why is he doing that? Why is she doing that? Is there kind of underlying problem why this person is not moving? Let me give you an example. Person doesn't move because he has arthritis.
Also possible.
How can he move if every movement hurts? Right?
Another reason to check with physician.
Right. So another reason, depression. Who is
Also
going to move if
Possible,
he is
yeah.
depression?
It's possible.
Who is going to move if he has heart problem? Nobody. So basically that, or breathing problem.
So you're saying that these two serious issues could be also connected to some other problems person has.
Right. Just you need to treat a person as a as a whole. You can't just get constipation and treat constipation alone. I don't think it makes sense. Because it could be, how can you treat constipation if there is an endocrine problem like low thyroid?
That's why people respect you, because you look at combination of factors, at everything, not just one problem, let's solve this problem, prescribe a pill, goodbye. So you check everything before you decide on a treatment,
Yeah, so that's what it is, and I think the most important thing is to make sure that it's complex. The problem is looked from different angles.
And do not wait until it's
No.
super serious. Go to physician if you see this problem, constipation, if you see hemorrhoids, check with doctor what could be done, how it should be done, to decide on the treatment. Don't do it just yourself because you're not doctor,
Yes, that's correct, because they don't do what you don't know how to do.
Yeah.
You know?
You don't know why you have this issue.
Right. And looking for the root cause always helps. Because if there is a problem with hemorrhoids, maybe not enough vitamin C, maybe not enough.
Or just you said water, the person doesn't drink enough water.
Just a lot of
He
stuff.
doesn't know about it.
Right. But if there is, why water? Because if there's not enough water, the stool becomes too hard. That's as simple as that.
Yeah.
That's pretty much it.
Thank you so much. I learned a lot today, and I'm sure our viewers also learned today a lot.
Yeah. Thank you very much.
We
See you
start
next
with
time.
you all the time. Thank you.